Hi, I'm Dr. Kuyunov here at Dental Prosthodontics of Rochester. Today I'll be answering some of the most common questions about dental crowns. What are dental crowns? Dental crowns are dental prosthetic devices. They're basically caps that go over the teeth. And there are different reasons to make dental crowns. Some of them to protect the teeth from further damage. The other ones are for aesthetics, to have a more beautiful tooth structure, or if it's needed to use for to improve the design of the teeth in the mouth. How do dental crowns work and when are they recommended for patients? So dental crowns, they reinforce the tooth structure by encircling the whole tooth with a cap. It's almost, if we can think about it, like a helmet that we wear when we drive a bicycle or rollerblades, just in case if a person falls, no damage is going to happen to the head. Dental crown does the same thing for the tooth. It goes over the tooth, encircling it, and keeps it uh, encased within the crown, so that the tooth will not split. If there is any micro fractures in the tooth, they will not break. If the tooth has lost a lot of tooth structure, dental crown will provide uh, additional material to compensate for the missing tooth structure that was lost. And usually, tooth structure is being lost due to wear, grinding, diet that is destroying the teeth, or sometimes even injury. There are different types of dental crowns, and dentists may decide to provide different dental crowns for each case. So let's speak about the most common case is that a back tooth, a posterior tooth is fractured for whatever reason, and therefore half part of the tooth is missing. And now, in order to provide this missing part, we are providing a crown that replaces the missing part and reinforces the tooth at the same time. So this is the first type of crown. The other crown will be for anterior teeth, and that's mostly for aesthetics. So if the smile is not really attractive, or it hurts the person to smile because he's shy, he or she is shy, so a dental crown can be placed on the tooth. Uh, another type of crowns is that they're being used under a partial denture. So if a partial denture is constructed, it has to clasp over the teeth, and if the tooth is not really strong enough or doesn't have those features that are needed for the partial denture to clasp on, so a crown will be made and placed on the tooth so that the partial denture can really clasp it properly. Now, besides the scenarios, there are also different materials for crowns. And in the past, the most common crowns were made out of metal alloys. We speak about gold crowns and silver crowns, and this was very common practice many years ago. It's less common now, although still used for different scenarios. But gold crowns were used to be a gold standard to which everything was compared to. After this, the other type that came into existence is a porcelain fused to metal crown. Porcelain fused to metal is we are taking a metal alloy such as gold or semi-precious alloy, which has a high content of precious metals. And then on top of the metal, a porcelain is being attached, and the porcelain is what gives the color of the tube. It's a white ceramic color. So these types of crowns, they are still very good, still being used nowadays, although less than before, and they're beautiful and strong, and and good crowns, and they're being indicated for both posterior teeth and anterior teeth, almost any situation. The next two types of crowns are fully ceramic crowns. The first one is lithium disilicate, and these crowns are being made. They're all ceramics. There is no metal in it. They're metal oxides, but no real metal, and they're made white uh, from inside and outside. They're very beautiful, translucent, and they came to be because in the anterior areas we wanted to have slightly more ceramic, less metal, and that's why those crowns came to be into existence. This is the lithium disilicate, also known as Emax. Different companies do it, and probably the most commonly used crown materials nowadays are made out of zirconia. Zirconia is a metal oxide. Zirconium is a metal, but once it oxidizes with the oxide, it's a fully ceramic material now. It's not metal anymore, and it's a strong ceramic material. It has different strengths and different translucencies to it. Some are very strong but not very translucent. Some are less strong but very translucent and are therefore more beautiful. Zirconia crowns are easier to make. They're more common and placed on almost any situations, posteriors and anterior teeth. Um, they can be used. They're very versatile because of their strength, superior strength, and aesthetics. They're probably the most commonly used crowns now in the world. The way the zirconia crowns are being made is the only way to make them is by taking a block of zirconia that is in the soft stage, and then a milling machine mills through it and makes the shape of the crown that we want to have. And it mills it when it is in the soft stage. So after it gets the shape that we need, it goes into a very hot oven where it's being baked, and then it becomes strong. So zirconia crowns are probably the most commonly used crowns nowadays. How long do dental crowns last, and what factors can affect their longevity? Dental crowns really can last for a very long time if being taken care of. If the patient has a good oral hygiene, there is really should be no reason for dental crowns to fail. What can happen? The most common failure that I'm seeing is that dental crown is being placed and the oral hygiene is not as excellent as it should be, and the patient will get a decay under the crowns on the tooth itself. So the crown is still good, however the tooth under the crown is being decayed. So then the problem is with the tooth, not really with the crown. The second most common problem that I'm seeing is that the tooth is having what is called a periodontal disease, meaning it has the gums around the tooth are not healthy and the tooth is not doing well. It's nothing to do with the crown, it's really had to do with the tooth. Extreme scenarios, sometimes what can happen is that the cement of the crown will become loose due to different reasons. Maybe a strong bite, maybe some parafunctional habits that the patient has, or trauma, but the cement of the crown can become loosened and the crown will come off. In cases like this, the crown can be re-cemented back, usually without any problems. No remakes are needed. In addition, the material of the crown can break, but that's unusual and extremely rare that a crown will fracture. But it can happen. I haven't seen it happen yet. I know it happened. What should patient expect during the dental crown procedure from start to finish? So obviously, a crown has to be prescribed by a dentist. Patient does not need sometimes when they need it. If a dentist says that it is needed, that's when the crown can be started. So it has to be prescribed first by the dentist based on the diagnosis. Once it is prescribed, a patient will be scheduled for the first appointment where the tooth is going to be shaped. Sometimes it has to be built up. If the tooth is fractured, it has to be built up to proper form and then shaped to receive the dental crown. When I say shaped, I mean that it has to be filed all around the tooth 360 degrees to provide the proper space for the crown material. And crown material does require space. If there is no space for the crown material, we cannot place the crown. So the first appointment is where the tooth is being shaped and impression of this tooth is being taken, whether in the digital or analog way, and it's being sent to the lab. The lab can be either in-house dental lab or an external dental lab. Different offices have it differently set up. Both are good. During that time, the patient will leave the office with a temporary crown. So when the tooth is being shaped, when the work starts to make the crown, after all the records are taken, a temporary crown will be made in-house and placed in the mouth, and the patient can leave home with a temporary crown. The second visit will be when the patient comes and we receive the final definitive crown, and this crown will be cemented on the tooth. Obviously, first it will be tried in, making sure everything is good, the bite is good, the aesthetics, the speech. Once we check all the points and put all the check marks that it's all good, then a final cement will be used to cement the crown in place, and that's about it. So in total, really, it is 3 appointments. The first one is exam and diagnosing that the crown is needed. The second visit is filing the tooth, and the third visit is delivering the crown. The benefits of dental crowns when compared to fillings and bridges. It is really based on the scenarios. Fillings are great when they are small and they can fill a small hole in the tooth. When the filling becomes too big, it doesn't perform the function of a filling anymore. It's kind of a temporary bandage, and it's doomed to fail. And when it fails really bad. Sometimes in a way that the tooth fractures in a way that it cannot even be restored with a crown. So big fillings are basically a problem. So that's really the diagnostic part that the dentist has to provide you with when he sees how big is the damage to the tooth. So the crowns are much better when we speak about big fillings. Now, regarding the bridges, and crowns are really coming hand in hand together. When there are like multiple missing teeth, then the missing teeth can be part of a bridge. We cannot place a crown on the missing space. However, if a patient has an option of placing an implant and having single separate crowns, whether on teeth or on implants, in between the teeth, sometimes it's better to have single units as opposed to everything, as opposed to connected units like a bridge. Are there any disadvantages or risks associated with dental crowns? There are. Obviously, any dental procedure has its own risks associated with it. The most common risk when preparing for a dental crown is the tooth will need a root canal, and if it is needed, it will have to be done. Now, why is the root canal will be needed when the tooth is being filed? It doesn't happen often. It actually happens rarely, but the moment the drill touches the tooth, it is experiencing a trauma, and most often teeth are recovering from this trauma, but some teeth are not. The fracture of the tooth or the decay was so big that when we start working on it, we realize that the nerve is not doing well. So now the nerve has to be treated before we finish the crown, and this procedure is called root canal treatment. This is the most common risk. What are the other risks of crowns? I cannot really think of major risks with dental crowns. They're mostly there for benefit of the patient. Not after every root canal a crown is needed. Root canals are there to treat the nerve of the tooth. If the tooth is completely intact and there is no problem, the whole tooth is there, and the root canal was done from the upper surface, and all the walls of the tooth are intact, in these cases, crowns are not really needed. If the tooth was broken or damaged or decayed beforehand, and part of the tooth is missing now, when the root canal is performed, the tooth is weakened from the damage and injury from before, and now it is weakened from the inside from the root canal. So in this case like this, the teeth become a little bit dry with time because they are not alive anymore, and they're more prone to fracture. Cases like this do require crowns for the teeth. So many root canal teeth will require crowns, but not all of them. How much do dental crowns cost, and what influences the price? Different offices, different providers have different fee schedules. They have different techniques. They use different labs, materials, and therefore it all comes into the cost of everything, any dental cost, especially specifically crowns as well. So the range for the cost of dental crowns can range anywhere between 1,300 to 2,500 crowns for teeth. It depends how big is the work. If it's a single crown, it can be less expensive. If it's a full mouth rehab with crowns, then there is a lot of skill that goes with it, and the skill of the dentist and how to make it properly, how to make the bite proper for the patient, so it actually improves the whole bite of the patient, the way they chew, and does not injure them, does not create any problems. In this case, the crowns will be more expensive, but then in case like this, more often it will be done with specialists. The specialists require, by definition, they've gone through extra training, extra schooling, so the patient will get this extra skilled professional working on them, and that will be part of the price increase. In terms of materials, that is also a part of the factor, although I don't think it should influence, but it does influence. The fabrication of the crown, whether it's in-house or in the external lab. Like anything else, you can have a lab that is doing a lot of one thing, and there is a poor quality control, but they make it less expensive. So therefore, this type of crowns can become less expensive. However, in other places, a lab can make very good, strong materials with high quality control on anything that leaves their house. Um, in these cases, the lab expenses, the outside lab expenses are higher. In our office, we don't really differentiate. We use just one lab for everything, crowns. So it doesn't really affect our price. That's how it's being said. But in general, it's really the skill of a doctor and what are the expenses associated with making the crown that will affect the fee of the crown. Do dental insurances cover crowns? A lot of dental insurances, they do have coverage for crowns, although it is limited. It will not cover the whole cost of the crown. It will cover some of it, and an office like ours or other offices, they will work with you closely to ensure we receive maximum benefit from the insurance towards your crowns. However, paying out of pocket is not that common for crowns. What results can patients expect from dental crowns before and after treatment in our practice? Most commonly, it is a difference in smile. The smile just becomes bigger. Most patients who are self-conscious about smiling because their teeth do not look well, there was a lot of damage in the past, decay, injury, whatever it is, and the belief factor that it can be changed was lost to them. Somehow they learn about us usually by referrals, reading about us, or a friend who had a similar treatment told them, and they come and I show them the before and after, what can be done, what can be achieved with dental crowns, and improve their belief factor in that the situation can be changed. And I'm seeing the pictures from before and after, and also what they tell us about what happens after the treatment. It's a big change. It's improved in smile, in self-esteem, in confidence. It's improvement in you know the social circles. They can go out with friends, smile and enjoy their food, and actually eat with their friends, not being ashamed. It can be really big life-changing event, and anyone deserves it. I hope I was able to answer some of your most common questions about dental crowns. If you would like to learn more about them and see if this is the right treatment for you, find out more information about it, by all means, please give us a call and we'll be happy to service you. Our phone number is 585 471 5689. Have a good day.